abnormal uterine bleeding. This includes menorrhagia, which is heavy bleeding, amenorrhea, no bleeding at all, and then having irregular menstrual periods, like bleeding in between your periods. Let's talk about menorrhagia. Menorrhagia is characterized by heavy and prolonged menstrual bleeding. It is severe in certain women that it disrupts their daily activities. The normal is between 6 to 8 tampons in each monthly cycle, in each menstrual cycle, but in some women who experience menorrhagia, they bleed 10 to 25 times more than the normal. You can imagine. Menorrhagia is common when you're teen and you're just starting your periods. You may experience heavy bleeding, and then when you're tending towards your menopause, like 50 years of age, you may also get heavy periods. What causes menorrhagia? One is hormonal imbalance. If your body produces these reproductive hormones, estrogen and progesterone, if it produces high or low, then you're more likely to get heavy bleeding in your periods, because it is these hormones that are supposed to regulate your menstrual periods. And then 2, abnormal structures in the uterus. If you have fibroids, if you have polyps, if you have tumors in your uterus, then you're more likely to get heavy bleeding in your periods. Then there are medical conditions like thyroid disease, if you have liver disease, kidney disease, or if you have platelet disorders, like if you have a low platelet count. Platelets are the cells which help you in blood clotting. So if they are low, you're more likely to get heavy bleeding in your periods. And then some medications like blood thinners, like heparin, if your doctor prescribed for you a drug like heparin or clopidogrel and other blood thinners, you may get heavy periods you may get heavy bleeding during your menstrual periods. And then there are other gynecological conditions like infections. PID can cause heavy bleeding. Some birth control methods like IUD, intrauterine device, if you have it, then you're more likely to get heavy bleeding. And then some other abnormalities like an ectopic pregnancy. This is a pregnancy that grows outside your uterus, and it is more common in the fallopian tubes. If you're having one, then you're most likely to get heavy periods. And then a miscarriage too can cause heavy bleeding, and it can be misinterpreted for a heavy period. So when you have menorrhagia, if you experience menorrhagia, you have to see a doctor to rule out what is causing the menorrhagia, because sometimes it may be a serious condition and it needs medical attention. How do you know that you have menorrhagia? If it requires you to change a sanitary towel or a tampon every hour, and when you change it, after that 1 hour, it is very soaked in blood to the extent of leaking, then know you have menorrhagia and you need to see a doctor to rule out the cause.